willingness to engage in that kind of a discussion, and thank you.
Well, thank you, and I thank you for allowing us the freedom to express our thoughts as we go into this markup. And I want to say to my colleagues, I don't think what we all want in terms of an outcome is all that different. But there's a tremendous difference in how we get there. And I'm reminded of the stimulus package we spent and where speed is causing waste right now. Tremendous amounts of waste. We need a stimulus package, we got one, but the speed denies the fact that sometimes we get it right. So I'm going to say some things this afternoon that are going to be pretty tough. But I believe in the goodwill of my colleagues that we actually all want the same thing. We want no one to ever lose their home from health care. We want no one to ever file for bankruptcy. We want everyone to have high quality access. We want the costs controlled. We want a viable healthcare industry that continues to produce 75% of the world's innovations in healthcare. Now, I've practiced medicine for almost 26 years. Most of you don't know that prior to that, I ran a business producing medical devices, made the first intraocular lenses in this country. So I have the experience from being on the supplier side as well as the provider side. And what is broken in this country is not healthcare. What is broken is the federal government thinking that we have answers and we provide solutions when there's very little information that goes into that process. And it's limited information. It's circular knowledge. It lacks the test of what's happening in the real world. The problem in healthcare, a lot of it can be directed to Medicare. We heard testimony about the lack of primary care physicians. Why do we have a lack of primary care physicians? We have a lack of primary care physicians because Medicare payment made it that way. A government program that we all think is necessary caused the shortage in primary care medicine. And now we're going to be about trying to incentivize, rather than fix the real problem, we're going to try to treat the symptoms instead of treat the disease. The disease is us. You know, the assumption that state insurance commissioners are powerless to control health insurance companies is ludicrous to me. And the idea that we think we can create a health insurance company, whether it be co-ops or otherwise, that are going to be more efficient than including profit, than the average health insurance company is poppycock. Because when you really look at the real costs of Medicare and Medicaid, their true overhead costs are about 25, 26%. They're not the 3 to 6% we quote all the time, because we never consider the cost of capital. There's no profit in it. And then which was misquoted by Senator Alexander, the hearings that we've had in the Oversight Committee, is Medicaid's at least $40 billion now, and we know from GAO that that's a hard underestimate of the amount of fraud and waste in it. And Medicare's at least $80 billion. So when the assumption is that we can do it better, you know what? We can't, and we won't. And we can pass this bill, and what we're going to have is another headache because we thought we could do it better than the way we do everything else in this country, is truly allowing forces to allocate scarce resources. Senator Harkin cares immensely about prevention. I do too. We don't get out of this unless we fix prevention. But us deciding how to fix prevention is a whole lot different than what a Steve Byrd has done at Safeway. And we will mess it up because we don't have all the knowledge and we don't have the right motivation, which is healthier, happier, longer living employees paying less money. What we'll have is a program. So Senator Harkin's intention, his heart is pure. But will it be efficient? Name me one efficient, effective federal government program that we've set up. Name one that's efficient and effective. A pilot's effective, we put him in an F-18, but is the Pentagon efficient? No. And we have that all across the federal government. So if our answer is we've got the answer and we're going to tell everybody else how to do it, I can promise you right now we're going to fail. And I don't think we should fail. It's too important. We have big problems in healthcare. And we need to come together based on what the real facts are out there, not our personal biases, and see what is working and how do we incorporate what is working. The second principle that I would bring forward is the states are doing all sorts of different things right now. Whether it's Massachusetts or Utah or Rhode Island, why would we want to limit progress in terms of what they're doing? We heard talk about low birth weight babies. You know why we have low birth weight babies in this country? It's because we have Medicaid that pays about 35% less for a doctor to care for an indigent woman than for another doctor. Well, guess who ends up caring for most of the Medicaid? Out of the 4,000 babies I delivered, 2,500 of them have been Medicaid. But what happens is that shifts down. And so what we promise in terms of care and coverage is just a promise. It's hollow. Because they don't get equal coverage. They don't get the same care. They don't get the same attention. And yet we've promised it to them, but we don't deliver it. And the reason we don't deliver it is because we don't put the resources behind it. Because we're living within a budget. And we ignore market forces. Markets aren't the total answer to this, but there's some. We'll never solve the problems in healthcare till we reconnect the purchase of healthcare to some small amount of economic pain with the person that's making the decision receiving the healthcare. You can deny that all you want, but everything else in our country works that way. And as long as we ignore that, we ignore it to our own peril, even with a government plan. You know, we're taught in medical school 3 basic tenets. And it'd be wise for this committee to pay attention to them. And the first is listen to your patient, and every time they'll tell you what's wrong with them. If you listen well enough and ask the right questions, they'll tell you. Well, we haven't done enough listening to everything that's going on out there. And we're also, when we listen, we're not hearing. Number 2, if it's been done already and isn't working, don't do it again. We're getting ready to do it again. And the third thing is don't do any harm. We truly have 1/6 of our economy that we're talking about now, and we have no idea what the long-term ramifications of what we're talking about doing in this committee is going to have on that economy. We think we do, but we don't know. And so we're throwing the dice for what we want, but we haven't listened to the patient, and we're doing things that we've already done that don't work very well. All you got to do, you know, the $39 trillion on Medicare is small. You know, a child born today in this country owes $400,000 in benefits they're never going to receive a thing from because we've not done what we should have done in Medicare and Medicaid and Social Security. And we're getting ready to create something new. I'm all for working with all of my colleagues, both sides of the aisle. But we ought to do it on what the real facts are out there and what we have learned. You know, we know that if we incentivize prevention the proper way, that we'll get a ton of savings. And we also know that if we don't do that in terms of the management of chronic disease, it doesn't matter what we do. We can do what Senator Sanders wants and we can create an absolute single-payer system. But you know what? The costs aren't going to go down unless we incentivize the management of chronic disease. They won't go down, they'll continue to rise. Because disease prevention is the way we get out of this. And unless this bill has that as its primary focus, the sustainability of it, the getting out of this problem, we won't cut the 7.2% inflation rate in healthcare, especially with the demographics of people aging. You know, sheltering children, as Bob Casey said, that's important. And we just modified S-CHIP, and we rejected a Senate amendment that would have covered all those kids and not raised taxes at all. And yet we got 16 million kids out there today that are eligible for S-CHIP and Medicaid, and they're not on the roll.